Of oral medication for the first 3 to 5 days, then we switch them to Invega Sustena. First injection 234 milligrams, second injection 156 milligrams. So the time length after the first injection is 3 to 5 days, and it's not more than 7 days. So it has to be between 3 and 7 days injection. If you start it on Tuesday, the following injection is on the Tuesday. Unless we give the second injection, the dose of Invega Sustena is not complete. After the second injection, it has to be once a month. It could be 117 milligrams, could be 156, or for some people it can be 234. Chris was on 234 every month. Highest, cannot go higher than that. Abilify, another atypical antipsychotic, it's available in injection form now. It's called Abilify Maintainer. Orally, it's available in 2 milligrams, 5 milligrams, 10, 15 milligrams, 20 milligrams, 30 milligrams. The highest dose is 30 milligrams a day. Can be given morning or evening, divided doses, work also. Quite a safe antipsychotic or mood stabilizer. Invega Sustena we covered. Saphis is also approved for treatment of schizophrenia and bipolar disorder, available in only 2 strengths, 5 milligrams, 10 milligrams. We do have some patients who are tolerating Saphis, doing well. Fanapt approved only for schizophrenia, 2 to 10 milligrams a day. Latuda approved only for schizophrenia, 40 to 120 milligrams a day. Abilify Maintainer, 400 milligrams is the usual dose, 300 milligrams for geriatric population, 1 injection every month. We don't have anybody on Abilify Maintainer yet. Okay. So that covered antipsychotic, antidepressants. Now we go to anti-anxiety. There are 2 types of anti-anxiety medications, benzodiazepine and non-benzodiazepines. Non-benzodiazepines are less commonly used than benzodiazepine because people like the euphoria that they get from benzos. So non-benzodiazepines are Benadryl, Vistaril, and Buspar. Buspar we learned before that it also helps the antidepressants to increase their efficacy. Can be used as an adjunct to increase the effects of antidepressants. Simple dosing 5, 10, 15 milligrams, 60 milligrams the highest dose. Benadryl is also used to control anxiety, so is Vistaril. Benadryl is also over the counter. You can buy it over the counter and use it too. Vistaril is not available over the counter. It's a prescription. 25 milligrams, 2-3 times a day, based on the needs. Benzodiazepines. The first benzodiazepine was Librium. It was the longest half-life, 100 hours. If somebody takes 1 dose of Librium, yes, it stays in the system for 100 hours. Why is that important? Because when people are detoxing from alcohol, they are likely to have seizures because alcohol depresses the seizure threshold. So Librium is the drug of choice then, because we want the person to go without seizures for 100 hours, 200 hours if necessary. Because first 5 days in the alcohol detox are critical. That's when the patient can have a seizure. If somebody gets a seizure during alcohol withdrawal treatment, usually goes into status, meaning succession of seizures, one after another. And the person can die during that course of seizures. So Librium is the drug of choice for alcohol detox. It's also an anti-anxiety medication. It's a good one. It has no street value, so you can prescribe it as much as possible. People do not usually sell it on the street because it's not like Xanax. Xanax is, I think, #1 used benzodiazepine in the nation. The advantage of Xanax is it works a lot faster. That's what people like it. It's absorbed in the stomach, gets into the system, half hour, it is working. But the half-life of Xanax is very short, 4 hours, it's out of the system. So the person needs another one if they like the effect of Xanax. So that's how dependence develops. One pill after another pill, 4 hours, 3 hours. When the tolerance develops, it's become even more often. Okay. So Xanax is available in long-acting form. We should be using more of Xanax XR, Xanax ER. The advantage of that is it stays in the system longer. And if we use the same strength, for example, Xanax 1 milligram 2 times a day, if you use Xanax 2 milligrams ER, it's 30% less in the system than the regular Xanax. So don't tell that to the patient. Don't tell that to the patient
Yeah,
because
right.
they'll ask you, you know, I'm giving you the same dose, 2 milligram, 2 milligram. Have fun.
Question, is insurance covered?
XR?
Yeah.
Yes, it is covered by most insurances. Okay, Valium is another antidepressant which is, I think, next commonly abused on the streets. But it's available, it has longer half-life. Valium, the advantage of Valium is it can be given intramuscular. Librium cannot be given intramuscular. No, Librium can be given intramuscular. Valium can be given intravenous and intramuscular. Klonopin only tablets and dissolving tablets. Klonopin less dependence, least dependent among all benzodiazepines. So people use Klonopin to detox somebody from Xanax. That's what is happening. Because it's a lot easier to take people off of Klonopin than from Xanax. Cerax is another benzodiazepine usually used to help people go to sleep. So is Restoril, Temazepam. Ativan is the short-acting benzodiazepine most commonly used in the hospital. It's available in tablets, available in short-acting injections. That's what they use, a lot of Ativan. Children, Pharmacopoeics, any hospital. Ativan is very commonly used benzodiazepine, inpatient. Side effects of benzodiazepine: sedation, tiredness, muscle fatigue, amnesia, and if they drive on it, they get a DWI. No questions asked. DUI. So tell the patients not to drive, not to operate any heavy machinery when they are on benzodiazepines, any of them. Okay, some of the commonly used medications in psychiatry or sleep-inducing agents, zolpidem, Ambien, one of the popular ones. It is popular because it helps people go to sleep. It's out of the system in 2 hours. Take the pill, go to sleep, it's out of the system. So people sleep on their own. Some problems with Ambien, because some people woke up in the middle of the night, they started eating, they woke up in the morning, they don't remember. And some people woke up in the middle of the night, went driving, had a car accident, came back, no knowledge of what happened. So it has to be carefully evaluated before it is prescribed. Somebody is happy with some non-Ambien sleep agents, leave them alone, keep them on trazodone. Ambien is also available in long-acting form. Ambien, that's a combination of 2 medications actually, Ambien CR. They have one Ambien to put them to sleep, they have another Ambien to keep them asleep. So that's how it makes it long-acting. It's the same zolpidem but released at different times when the person is sleeping. Chloral hydrate, another very strong hypnotic agent, but we hardly use it. It should be used only in inpatient settings. Intermezzo. Intermezzo is another Ambien-like substance. It's available. The advantage of Intermezzo is it's available in dissolving tablets, 3.75 milligrams. So people get faster effects when it dissolves in their mouth, through the saliva, goes into the blood. It works a lot faster than other hypnotics. Light therapy is also used as an adjunct to antidepressant treatment, especially during winter months, seasonal affective disorder. Exposure to bright light, as much skin as possible, 2 times a day, half hour each time, helps person who are depressed during the winter months when the days are shorter. Online, I think they are selling special bulbs for light therapy, then this and that. That's all business trick. Any light works. You have 100 watts bulb, sit in a small bathroom, expose your skin as much as possible for half hour in the morning, half hour in the evening. It will work. Okay. Do we have geriatric in our geriatric population in our program? We do?
Yes, but they don't have to be geriatric to be demented, right?
That is correct. Do we have demented population?
Yes.
Okay. Commonly used treatment for dementia is with Aricept, donepezil, used in 5 to 10 milligrams a day, usually given at night time. We had one patient who had side effects from Aricept in your program. 5 to 10 milligrams is easily tolerated by people. Again, treatment of dementia is basically to arrest the progression of dementia. It does not get better, but we try to stop it where it is so it does not get worse. That is the treatment. We are not expecting miracles from these medications. They basically help the person live the way he is without getting worse. Nimanda works the same way Aricept does, but according to the studies, Nimanda and Aricept together work better than individual medication. Exelon patch, oral patch, is also used in treatment of dementia. For people who cannot tolerate Aricept, some people cannot because it causes them to become psychotic, dangerous, and delirious. That's when Exelon patches are used. Treatment of alcohol dependence. The only FDA approved treatment for alcohol dependence is disulfiram, antabuse, that was approved in 1950s. Still used very cautiously because of the side effects. It's used in a very controlled environment. It's not for everybody because once people drink on antabuse, they go into a delirium and they become dangerous. So if somebody is in a residential program, being observed by the staff 24 hours a day, will be eligible to get disulfiram, which is antabuse. 250 milligrams 2 times a day, still used but less commonly. Naltrexone, Ravia is another medication approved by FDA for treatment of alcohol dependence, usually given 1 tablet every morning, the dose of 50 milligrams to start with, helps people control their craving for alcohol. Naltrexone is also available in injectable form. It's called Vivitrol injection, once a month. We have done a lot of studies. We know that if the person is using Vivitrol IM in a series for 3 to 6 months, they have less days of alcohol intoxication. Camprol is another approved medication by FDA for treatment of alcohol dependence. comes in a tablet of 333 milligrams, usually given 2 tablets 3 times a day, highest dose. It works. Baclofen and Neurontin also used for alcohol dependence. Neurontin is not approved by FDA. Baclofen is not approved by FDA. But the other medications I mentioned are approved by FDA. But does Neurontin work? Yes, in some people. The way Neurontin works is we give them 100 milligram tablets. If you tell them that whenever you think you are going to have an urge to drink, take 1 or 2 tablets every 15 minutes unless the urge goes away. The highest dose of Neurontin is 3,500 milligrams a day. So it takes about 35 tablets for them to take the full dose. That does not usually happen. But it helps them control their craving, it helps them control the drinking. Even if they end up drinking on Neurontin, nothing happens, no damage done.
Dr. Davis? Could it work for other addictions?
Neurontin,
Gambling, food, shopping?
I don't know, it's not shopping. I don't know. I don't think it has been tested in other compulsive behavior. Opioid dependence. Again, one of the common dependence, painkillers, use of heroin. Usually starts with painkillers or heroin. Heroin first, nobody starts using intravenous at the first time. They usually try sniffing it. And when they get the high from it, that's when they go for the intravenous use. There are several approved treatments for opioid dependence. One of them is Suboxone. Suboxone is a combination of 2 medications, buprenorphine and naloxone. Naloxone is the receptor blocker, buprenorphine is a narcotic, but very, very mild. Usually these are available in sublingual films. People take it 1 to 2 a day, helps them with the cravings or narcotics. Heroin or opioids or the pills or oxycontin, whatever. Subutex is just buprenorphine. The abuse of Subutex is possible because it does not have the blocker in it. So people use less of buprenorphine, Subutex, and more of Suboxone because the blocker, the naloxone, gives us the advantage of controlling the dosage. Otherwise, people will end up taking a lot of buprenorphine. But again, it's available Subutex and it's available for a reason, because if somebody is using Suboxone, they get pregnant. They cannot use Suboxone during pregnancy. It's absolute contraindication. A lot of fetal defects. So Subutex can be used under those circumstances. Clonidine is used inpatient and outpatient. Basically, if you do not want to give somebody Suboxone or Subutex, you can give them Clonidine, which basically is going to help them control their withdrawal symptoms. Methadone is also approved, FDA approved treatment for opioid dependence. It's available through different clinics. We have clinic in Patterson, we have clinic in Passaic, clinic in other parts of the state. Usual dose 50 to 100 milligrams a day. It's usually dispensed at the clinic because of the street value. Methadone has a lot of street value. So it's given under supervision and the person drinks right in front of the nursing staff there. But if they are demonstrating that they are able to control it, then they go to different phases. The highest phase is phase 6. That's when the person gets 13 days supply and comes every 2 weeks to the clinic.
Wow. I didn't think it was ever distributed like that.
It is, bottles. They give 13 bottles, 1 bottle every day. Nicotine dependence, which is, I think, the commonest among all the dependencies. The FDA approved treatment for nicotine dependence is nicotine patch. It's available in 3 strengths, 7 milligrams, 11 milligrams, 21 milligrams. If somebody smokes 10 cigarettes or less, they require usually 7 milligrams or 11 milligrams. somebody more than a pack, 21 milligrams a day. And the patch has to be taken out at night time because it gives them nightmares if not taken out. The lozenges available, they can take 2, 3 lozenges when there is an urge to smoke. Inhaler is also available, nicotine inhaler, 1-2 times a day. Chantix, another FDA approved treatment for nicotine dependence. The side effect of Chantix, depression, suicidal ideation. People completed suicide, so it is not for our kind of population who has suicidal history. It's a 12-week treatment. It comes in different strengths, needs to be gradually increased. And then once the person is nicotine-free, can be discontinued after 3 months. The newest is the electronic cigarettes, which I like, because it gives them the symbolic gratification of smoking. Can be smoked inside the buildings, can be smoked in the hospital, inside the patient room, safe. The only vapors that come out of nicotine cigarette is nicotine, which is not dangerous compared to what comes out of a cigarette smoke. The other ingredients that are associated with nicotine in cigarettes are more dangerous than nicotine. Having nicotine is having a cup of coffee, like having a cup of coffee. So it is available. It's available, very common, even to the stores. I think Quick Check may have one too. Yeah, it's a good treatment. Okay, the last one is medical marijuana. Approved by the state of New Jersey. John Carzine started it, Christie completed it. It's available throughout the state. 3 clinics, one in North Jersey, one in Central Jersey, one in South Jersey. All right. It comes with a package of conflicts. One is marijuana is an addictive substance. Why is it approved for these treatments? The purpose is to treat cases where the abuse is least. For example, people who have cancer. Now, how long are they going to live? How long are they going to abuse the medication? Not too long. So terminal cancer, pain with terminal cancer is an indication for medical marijuana program, MMP. Other one, very absolute indication is multiple sclerosis, which is a progressive illness, does not get better, so marijuana is approved for that. Chronic pain conditions, approved. The only psychiatric condition they have so far is social anxiety disorder. It's coming. I think it's coming to psychiatry slowly. It's approved. It's available at Montclair Center, close to us. Usually they get an ounce to 2 ounces of marijuana. Costs about $150 for each ounce. They want 2 ounces, $300. Comes with the buds. They give you the wrappers at the same time. Smoke it. There's some surprise, some precautions they tell you. Not to smoke near a school, not to smoke in public places. You can smoke at their home. Okay, marijuana chemically it has 2 ingredients. One is THC, tetrahydrocannabinol. That's what we are concerned about. It's a psychoactive agent that produces all the psychiatric symptoms that we see. CBD, cannabidiol, is another agent that seems to have a lot of therapeutic value. And that's why medical marijuana program is using, not for THC purposes, but for CBD. That increases the pain, not increases the pain, cures the pain, cures the other conditions. There are a lot of research done on marijuana, not in US, but outside. And those people have been using it, especially in Israel. People are using marijuana for chronic condition and untreatable conditions. All right. Wait. Not done yet. The last page is the formulary draft. We need to update it.
update yet.
No, we have to update it again.
Yeah.
So this is what we are going to be using, 2014, say that, 2014. It needs to be upgraded, which we will do it, Paula and I. And it will be available next month. Because it covers all the medications that we spoke about. And if there is anything that needs to be added on, we will do it. We meet every 3 months. These are the only medications approved by NewBridge agency. If it is not in the list, it's not prescribed, not approved by NewBridge. That's why we are going to use the formulary draft strictly for the one that are approved by our pharmacy committee. Okay, go ahead, Dina.
I think,
Dave, the
Wanted
1 to
to-
2 ounces of marijuana, is that per week?
Now,
Per
2
day?
ounces of marijuana, highest dose 2 ounces of marijuana per month.
Oh, okay, okay, dang, that's a lot of money.
Yeah, I think they can make about 30 out of 1 ounce marijuana, they can make 30 bites, cigarettes, whatever you want to call it.
So it's
Somebody
basically
using
one a day.
1 to 2 a day, yeah. Based on, what the condition is.